Hi everyone, this is Dr. Langley-Brady, and we're going to talk really quickly about pediatric strict I&Os. And these are crucial for positive patient outcomes. Absolutely crucial, especially in pediatrics. So, what's the big deal? Well, the smaller the patient, the faster a fluid imbalance could lead to a PET call, trip to the ICU, and maybe demise, but we don't want that, right? So strict intake and output is crucial. If your infant or toddler wears a diaper, diaper weights are mandatory, and not wait till the end of your shift, the end of your clinical day to try to figure out if they voided or not, and then try to weigh them. No, they void, you weigh the diaper, you get a moment, you go chart. Keep up with those I's and O's. You really need to pay attention to this. And as our pediatric patients get older, strict I's and O's can be relaxed somewhat. But however, think about if your patient has the potential for dehydration or fluid overload, i.e. nausea, vomiting, diarrhea, renal or cardiac diagnosis, febrile respiratory distress, failure to thrive, etc. They're prescribed one or more medications, which may alter renal perfusion, if they're receiving transfusions or chemotherapy, if they're post-operative or post-sedation, you need to strictly monitor intake and output. No ands, if, or buts. Must be done to ensure the safety of your patient. Please use your critical thinking skills. If someone says, oh, you don't need to measure that, okay? Measure that for the rest of your career. Additionally, charting should be completed as if your patient had a dietary or nutrition consult ordered. Why? Well, I already did this, but about a year ago, I took an interdisciplinary course, and there were some dietary and nutrition graduate students there. And I asked them, what's one thing you would recommend for nurses so I can share it with my students? And they said to chart intake and output thoroughly, because it makes their job easier. So think about if we charted strict I's and O's in the way that we're supposed to, then a dietitian could quickly evaluate the patient and make recommendations. If our charting is poor and incomplete and a dietary consult is ordered, the dietitian comes and says, well, there's not much here to work with. So then they're going to place an order in the chart for the nurses to write or to keep strict I's and O's, or what's called a calorie count, up to 3 days. That is a thorough documentation of everything going in that patient. And after 3 days, the dietitian can come back and evaluate what they've taken in the amount of protein and fats and carbs, etc., and then make a recommendation for dietary changes. So this is beneficial to our patient that we chart this way for all of our patients, right? Because then if we need someone to come and evaluate them and their intake or lack thereof, it's already in the chart. Easy peasy. So we're going to talk about some things. Now, count versus volume or weight. We have so many problems with this when it comes to charting. So I got a couple slides, just we're going to play around with some non-medical stuff and then medical stuff in count versus volume or weight, right? So boom, 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 boom. Here we have some kickballs, right? How many kickballs do we have? We have 8 kickballs. I've counted my kickballs. Simple. Now we have a scale over here. So boom, we have 8 kickballs, little bitty kickballs on my scale. Then they weigh 80 grams. That's the difference between a count and a volume or weight. Simple enough. But quite often, students will see somebody erroneously charted both at the same time, 80 grams and 8. And you're like, well, did I have 80 grams of kickballs or 8 kickballs, or did I have both 80 grams of balls and 8 kickballs? Well, the way that's charted is you had both, which is the incorrect way to chart. We chart one or the other. We don't chart both unless both actually did happen. So moving on, here I've got what? cups of orange juice, the little bitty containers that we have. 6 cups of orange juice. So if your patient said, I drank 6 cups of orange juice during the day, and you charted 6, that's it. That's a count. I've counted how much orange juice they took. Boom. Here's a huge container of the 708 milliliters of orange juice that they consumed. That would be the volume of orange juice they consumed. This is pretty easy, right? Back to basic math and documentation. So a count of 6 or volume of 708 milliliters. Now here's where we start getting a little trickier. You're going to pretend that's a sad looking little pad or diaper or something. I couldn't find anything that looked good. Now, here on the left, we have a patient that said they had 3 poos. We're in peds now. 3 poos during your shift. So you would write stool count of 3. Easy. I would also want you to then right click, add comment, and describe them as you were taught in 6700 or 3200 if this is our BSN. So that would be size, color, consistency, odor, if it's important, and then anything else you might find in that stool. So blood, mucus, a penny, a Lego, worms, those sorts of things. But if I took all of those poos and boom, 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 they're on the pad on the scale, then we no longer have a stool count. We have a weight of 300 grams of poo. Makes sense. We're not going to have both. We're going to have a count, or we're going to have a weight. Now let's look at urine. So you may have an older peds patient that says, oh, I peed once in the toilet. So I have 1 void count for the day. That's all I have. Or perhaps they use the urinal, and there's 400 milliliters of urine in this urinal. Perhaps we had a pad of some sort, and they peed in the pad, and that pad weighed 100 grams. Now we know in our charting at CHOG and AUMC that grams is equal to milliliters in the charting. It's already worked out that way. So you would just put that 100 right in there in the urine volume, okay? Even though volume is technically liquid and in mLs and weight is in grams. It's all annotated the same for urine. 1 ml is equal to 1 gram. Easy peasy. Now, diapers. Everybody gets so confused about this, and it's really frustrating for practitioners that are then trying to ascertain exactly what your infant put out. So if I had 1 diaper on the left with urine in it, and mom accidentally threw it away, can't find it on top of the trash, so I can't weigh it. That is diaper count of 1. That's all. If I have a diaper and I can put it on the scale, there's urine in there. Okay, we're not going to put this take the baby wipes out. If I have that diaper with urine, then I put it under weighed diaper in the EHR. And this one happened to be 140. So it measures grams on the scale, but it says mLs in the chart, same thing. So we would chart 1 diaper count if we couldn't weigh the diaper. Otherwise, we always want to weigh our diapers, and it's 140 mLs, and that's what we're going to chart. Now, when it comes to stool, boom, we can say there was 1 stool, one poopy diaper, and Grandpa accidentally threw it out. It smelled so bad. I had this happen a couple weeks ago. It smelled so bad they took it way down the hallway and put it in a big trash can. So we couldn't weigh it. So that would be a stool count of 1 or a diaper count of 1, depending if it had anything else. If it's just stool, it would be a stool count of 1. If it's a weighed diaper, we can put it on the scale and it has stool in there, then it would be again that grams, okay? And I'll show you how to do it on another sheet. So we're saying this poop weighed 80 grams. Now, here's where everyone gets really mixed up. If we have both urine and stool, a little complicated. We can't separate them out unless it's a huge, hard-formed ball of stool. Then we could potentially pick it up and put it on a dry diaper and just get the weight of that stool, right? Otherwise, stool and urine are mixed together in the diaper. So again, if somebody in the room, aunt, uncle are in, and they're like, no, 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 this smells bad, we're tossing it out, or they accidentally put it in the trash, they've been all up all night in the ER, they forgot you said to save the diaper so you can weigh it. So they said, yeah, they peed and pooped in the diaper we threw away. That'd be urine, diaper count of 1 with stool of 1. Simple. What we need to do, however, is put this diaper on the scale. And then that entire weight, which is 180 mLs in the chart, is going to be under weighed diaper, 180. That's where the weight goes. And then down further on the sheet where it says stool, we'll go to count and put a 1. Because we can't separate that urine and that stool. We don't know how much was which. But the volume that we measured, or the weight that we measured, is going to go under urine weight diaper. And then the stool is going to go under stool with a 1, same column, and then a note, add comment, and whether it was small, medium, large, extra large, blew out all over the bed, brown, yellow, green, what have you, seedy, mushy, liquid, etc. Found a dime in there, marble in there, what have you. So those are the things we need to annotate for that. Now we're going to move on to just some sample charting. So let me get out of this and pull up this. Okay, I will really quickly, I was able to do a de-identified screenshot. So this is of an older child, and this looks straight from your EMR or EHR. Medications, you can see at the very top here, they automatically pull over when you scan and sign off your med. Everything else we need to annotate. So under oral, when we have caloric oral fluid, those you need a volume, 118 of apple juice, 240 of, what have you. So caloric oral fluid, this is everything outside of milk that has calories, right? So apple juice, orange juice, Sprite, Coke, Capri Sun, what have you, popsicle, that needs to go in here. And then when you've got this total, like you see, this is 100 right here. Someone should have then right-clicked, add comment. I can't show you that on the screen. And then say what it was, 100 of apple juice. Easy. Now milk, we separate milk out. Milk is quite different calorically. It can or cannot have fat, depending if we're whole milk 2%, 1%, or skim. And then it has protein and vitamins, all sorts of stuff that we're not going to see in our other oral fluids. So we really need to pull milk out and separate it from everything else. So if a dietitian comes to look at it, they can ascertain the amount of fat and protein, etc., that this child consumed. And again, same thing. If this was a whole little half pint of milk, it would be 240 that we would chart. And we would then right-click, add comment, what type of milk it was. Non-caloric oral fluid. So think of Sprite Zero, Diet Coke, unsweetened herbal teas, unsweetened regular tea, like black tea, unsweetened coffee. Yes, we have some teenagers that might drink a cup of coffee. And then we have free water at the bottom. We can also customize the screen to add an electrolyte fluid, such as Pedialyte, and/or Gatorade. And when it comes to percent of snack eaten, that's exactly at the percent and the percentage of the meal. And then we need to comment and say exactly what they ate. But you see here, this is urine void volume. So this particular older child either used a urinal or perhaps a urine hat in the toilet. They could use a bedside commode. If it were a bedpan, you poured it into the graduate cylinder to measure it. All those are volumes. If it were in the urine void count, they would have said, oh, I went one time. Like they physically went to the commode and voided in the toilet and flushed it. The same thing when we're looking at emesis. and stool. So further down, I apologize, this got a little blurry trying to get the de-identified screenshot. But you can see here, this is an infant because we've got breast milk, mother's own milk, amount of time feeding. Then when we go down to weighed diapers, diaper count, stool volume. So now I'm going to get out of this and actually go to a sheet that I made to help explain this. Okay, so if we look at here, I tried to copy some of what you already see in the EHR, not identical, but close. But let's go back down to our fluids. Now, if mom pumps her breast milk and leaves it, and then has to go tend to her other kids, and you feed the baby 2 ounces or 60 mLs of breast milk in a bottle or formula in a bottle, of course you're going to put the 60 in there. All good, right? But if mom is actually in the room and she's nursing the baby, you need to annotate the amount of time in which she nursed, and that's both sides. So if you were to go in and see 10 minutes written down on the little papers that we leave in their room, you need to ask the mom, was that 10 total or just 10 on one side? Some of our new moms don't really understand. We need to nurse on one side, burp, and if baby falls asleep, still kind of stimulate them to put them on the other breast to feed as well, so they don't become engorged on one side or the other. We want total minutes of breastfeeding. So we're going to say this baby breastfed for 20 minutes. Okay. Percent of meal eaten. For example, breakfast tray. We're talking about foods here, not liquids, but foods. So if foods had a pancake, eggs, and bacon, and the patient only ate the pancake and the bacon, so they ate 66% of that meal. So I can put percent is already calculated. We don't type that in. And then I would need to, this is not going to do it here, but I would right click and add a comment. And I would say pancake and bacon. Okay, you would not be able to see that. You would have a little triangle in the corner of that screen on the EHR. Same thing for the percent of snack. And it's funny today, you know, people are going, well, what about bites? You can customize your screen down here for bites. So we're going to go down here and say we had 5 bites. And then I would right click and add comment, 5 bites of banana. And I'm not going to spell it right, I'm sure. Enteral feedings, we have formula, we have free water flushes that we do after that. Let's see. So let's go down here really quickly again to that output. So I have a child that weighs diapers, and I took this diaper weight, and the diaper weighed 120 grams. So 120 grams, but there was also stool in there. And I don't know how much was the stool, so I can put a 1 in that column, right? And I could then have right-clicked and said small green CD. But say maybe later that day, there was a diaper that got thrown out. Can't measure it, it's gone. So I do a diaper count of 1, and they said, whoa, hold on. There was a huge poop in there too. So I'm going to have to put 1. And then I could add a comment saying, per mom, very large stool, brown, stinky, you know, what have you. And let's say later, what else could we do? We went to change the baby's diaper. There was no urine in it at all. That little blue line was not indicating on the outside of the diaper to let you know that it's been wet. No urine, it did not say, you just had a nice ball of stool there. So you could actually then just weigh that diaper to get the stool volume, and we're going to say it was 40. And then we would need to right click, add comment, and tell about the stool, just like we did before. Small green CD, actually that should have a comma there. Emesis, same thing. If we can measure the emesis, say perhaps they spit up all over their baby blanket, and you could weigh the baby blanket and then subtract a dry baby blanket weight. Perfect. And we're going to say it was 34. However, the next time they threw up all over mom's shirt and her jeans. We can't really determine. We can just say it was emesis count of 1. And then we can add a comment and say approximately, if it's going to let me do my approximately, it's not going to let me type it. All right, my screen's messing up here. It won't do my approximate symbol. I'm going to try one more time. Oh, okay. So approximately, say 30 mLs. Whatever it is, you just give it your best estimate. That's all we can do. Sound good? Because we can't get mom's identical clothes that are not soiled and weigh them and compare them. So we just have to do an estimate for spit up or emesis that cannot be measured. If they go in the little emesis bag, the little, they call them barf bags on my unit, the little purple ones or the little green ones, then you can hold it out and measure that as well. But that's kind of it. And then you should have a running total down here, whatever it was for the day for your patient. And that's kind of it for documenting your pediatric intake and output. I hope you found this helpful, and we'll go over it some more when I see you in clinical. Take care. Bye-bye.